I have with me Sean Duffy, who's the CEO of Omada Health and a co-founder. Sean, thank you so much for joining us today. And I mean, really exciting day. You're going with an initial public offering of 7.9 million shares at $19 per share. Talk to me about why now. Why is this moment so important? Because you're the second digital health company to go public this year, and all eyes are on you.
Well, firstly, thank you for having me. Such an exciting day. So congrats to everybody, at Omada. So the why now, really it's a mix of what we see in the business. So what we love is we've expanded from one care area to four. We love that last 12 months revenue grew 44%, while on the back of only 11% increase in OpEx. And meanwhile, we like what we see in this world of GLP-1s and feeling the customer demand. So that's the business. And then the capital markets have in many ways asked us to come in. And these are not shy investors. If you pause for that 5 minutes at the end and be like, what do you think? Like it, dislike it? Would you be interested? They'll tell you. They'll tell you. So we felt pull.
That's really good. And I'm glad you brought up the GLP-1s because I feel like that has been the focus on the company, though you do have other chronic diseases that you cater to. Why is it the moment right now, even though you don't sell GLP-1s and you don't prescribe them, why is it so important to meet the moment now and say go public now versus during that pandemic time where a lot of digital health companies were coming to the market?
Well, starting backwards, in the pandemic era, we had just expanded to new care areas. And I had sensed that these benefits leaders would really prefer working with one partner across multiple care areas, but we had just started that. And when you're becoming a public company, you want to make sure to have the proof points out there. So we'll hang out, we'll stay private, there's no rush. In retrospect, it's a great decision, that worked out. And then for your comments, the GLP moment hit. It almost feels like the entire Omada journey leading up to today left us in a place to be able to serve our members on these meds, because an injection's not getting to know you. An injection's not saying, what might a week look like in your eating behaviors, your exercise behaviors, your strength training, your activity, and that's where Omada can come in to operate alongside the med.
So when we're talking about these patients that you care for, you're guiding them through their journey, through their health journey. And part of it is, digital technology and technology that didn't exist when you founded in 2011, right? So you've had to spend a lot keeping up to pace with what the technology is, including AI, I'm assuming as well. But there's also the digital tech and wearable side of it. So CGMs or continuous glucose monitoring devices are part of that story. We see that as used largely by diabetics, but it's become part of sort of the general public sphere. I see on social media folks just wearing CGMs tracking their food. So is that included as part of the journey? If someone has got access to a CGM on their own, can they come to you and be part of the journey there as well?
Yes, so CGM's critical, especially for Omada's members who have diabetes. And so we have a device arsenal, if you will, scales, blood pressure cuffs, glucometers, and CGMs. And I have a really neat relationship with Abbott and a proprietary relationship with Abbott to ensure that all our members with diabetes start their journey with a CGM because our care teams love it. The fidelity of the data you get from CGM versus A1C gives them a better path toward helping our members, and our members love it. And so it's a combination of the devices, our compassionate care teams, and the software that ties the room together and gets outcomes, and a CGM has been a critical part of that journey for our people with diabetes.
You mentioned that you were pulled into the market, kicking and screaming against your will, I'm sure. And so I'm curious about what you want the market to do for you, because you're going to start getting all sorts of questions about profitability, about how the company is growing, and the markets and lines and areas. And that's going to be a lot. You're going to be under a microscope like you've never been before. So talk to me about that and what you think the market is looking for from the company.
Well, what's fun is many of the shareholders that are joining today, we've known each other for years. And I walk into these rooms, it's not like we know each other's kids' names yet necessarily, but they're like, Sean, incredible progress, phenomenal Q1. You just keep doing what you said you're gonna do. And I think that that's fundamentally what the markets want. And it's germane to our values at Omada, which is cultivate trust. And it's just a neat moment in time where the new shareholders that are coming in can help me and help us imagine a path to not just the millions of members, but the many tens of millions, which ultimately helps us achieve our end mission, which is explicitly to bend the curve of disease.
And really quickly, to final question for you, looking at the trajectory for the company, looking at the focus on the GLP-1, you've set yourself up with other chronic diseases. Do you anticipate that the GLP-1 market is one that will just sort of fold into natural conversation, or is it a standout for you?
You know, it's one where a couple years ago we started to feel just enormous asks for our customers to help them solve their worries about the positives of the med and some of the potential complexities. So it's our view is it's an exciting new chapter. Now that being said, we're really just getting going. I mean, last year in March, we were privileged to work with Express Scripts through EncircleRx for that GLP solution, and now we work with 2 of the 3 major PBMs to support people alongside the GLP-1s with just excellent services and lifestyle change.
So we'll be watching that. Thank
Please
you
do.
so much for joining us.
My
Sean
pleasure.
Duffy, CEO of Omada Health. Brad, back to you.
Anjalee, thanks so much. Appreciate you for bringing us that interview.